Have you ever wondered why some people seem to defy age, moving with grace and strength well into their golden years, while others struggle with basic tasks? What if I told you that the secret to maintaining mobility, balance, and independence lies not in lengthy gym sessions or the latest fitness fad, but rather in 6 simple, scientifically backed exercises you can do right at home? Whether you're trying to regain your strength after 60 or simply aiming to enhance your daily life, this video will unveil methods to transform your body and invigorate your movement. Join us as we delve into exercises that not only build muscle, but also restore confidence, autonomy, and vitality, because aging should never mean losing your freedom. Are you ready to take the first step towards a more active, empowered you? Do you still think that a daily walk is sufficient to keep you strong, agile, and healthy after turning 60? While walking is great for the heart, boosts mood, and clears the mind, it doesn't halt the accelerated decline of muscle mass, strengthen balance reflexes, or prevent falls, the silent adversary responsible for the majority of disabilities and fractures among older adults. Beginning at age 50, our bodies enter a process known as sarcopenia, leading to a loss of muscle mass between 1% and 2% annually. Without proper training stimulus, this decline results in weakness, poor posture, joint pain, shuffling steps, slower movement, instability, and a lack of confidence in mobility. What's truly alarming is that walking alone only engages the cardiovascular system and muscles on a superficial level. It fails to activate power fibers, safeguard joints, and strengthen the deeper muscles essential for fall prevention. But here's the encouraging part. This deterioration isn't an inevitable part of aging. Research indicates that even beyond 60, 70, and 80 years of age, it's possible to rebuild muscle, regain strength, and restore balance with just 10 to 15 minutes of targeted exercises each day that activate the glutes, legs, core, and neuromuscular stability. Simply put, it's not age that robs you of your mobility. It's the absence of proper stimulus, and there's still time to recover that stimulus. That's why in this video, we'll explore 6 therapeutic, gentle, impact-free exercises that are scientifically grounded, which can revive your deep muscles, fortify your joints, and rejuvenate your posture, balance, and gait. If you're eager to age with empowerment rather than fear, stick around until the end, because what you're about to learn could transform not just your mobility, but your entire daily life. Exercise number 1, wall push-ups. Wall push-ups are among the most comprehensive, safe, and transformative exercises for older adults aimed at restoring posture, functional strength, and respiratory health. As we age, we often develop drooping shoulders, a rounded back, and a collapsed chest due to weaknesses in core and postural muscles, coupled with stiffness in the chest and upper back. This hunched posture, known as dorsal hyperkyphosis, not only ages you visually, but also decreases lung capacity, alters balance, heightens fall risks, and accelerates mobility degradation. Wall push-ups specifically target this issue by strengthening the chest, shoulders, triceps, and the stabilizing spinal muscles, particularly the serratus anterior, spinal erectors, and transversus abdominis, which serve to keep the torso firm and aligned. Unlike traditional floor push-ups, the wall provides a safe angle that allows for muscle activation without overburdening the wrists or jeopardizing the neck or lower back, a crucial consideration for individuals with osteopenia, osteoarthritis, or early-stage weakness. Additionally, the body functions as an interconnected system. When pushing against the wall, the core engages reflexively to prevent torso collapse, enhancing the body's core stability, a key element for maintaining an upright posture, standing without fatigue, and moving with control. Interestingly, this exercise not only corrects posture, but also mitigates the pathologies associated with it, returning the body to a safer, more efficient alignment. But the benefits don't stop there. Wall push-ups also enhance breathing, circulation, and biomechanics in daily movement. By expanding the chest and strengthening muscles that support the rib cage, the body regains its ability to expand the lungs more fully. This is vital as lung tissue elasticity declines with age and respiratory volumes decline. A correct training approach in this area enables older adults to breathe deeper, oxygenate their tissues more effectively, walk with increased energy, and experience less fatigue. Moreover, wall push-ups foster a fundamental pushing motion critical for independence. Whether opening a door, rising from a chair, regaining stability after losing balance, or lifting objects, this muscle chain is essential. Performing this exercise while consciously breathing, inhaling as you lean toward the wall and exhaling as you push away, activates the diaphragm, alleviates neck tension, enhances the function of the parasympathetic nervous system, and helps lower stress. Essentially, it's a singular movement that corrects posture, fortifies the body, enhances breath, protects the spine, and brings stability back to older adults in minimal time and without machines, floors, or impact. With consistent practice, it transforms the way one stands, walks, and moves, restoring security and dignity step by step. Exercise number 2, calf activation. Calf activation stands as one of the most underestimated yet crucial exercises for health, mobility, and independence after 60. The calf, primarily composed of the soleus and gastrocnemius muscles, acts as a powerful muscular pump, circulating blood from the legs back to the heart with each contraction. As we age, daily movement tends to decrease, leading to diminished venous system efficiency. Valves in the legs must work overtime against gravity, which promotes swelling, varicose veins, nighttime cramps, a sense of heaviness, and compromised circulation. When the calf muscles weaken, this system falters, resulting in blood pooling in the ankles and sluggish venous return, adversely affecting circulation, tissue oxygenation, and muscle recovery. Consequently, many older adults may feel as though their legs lack strength or vitality. Fortifying the calf reactivates this natural pump, enhances blood flow, reduces fluid retention, alleviates inflammation, and combats the chronic fatigue many endure in their legs, accomplishments that no medication or leisurely stroll can achieve alone. In fact, recent research reveals that when correctly activated, the soleus can significantly boost metabolic expenditure, regulate glucose levels, and enhance venous function, making it one of the vital muscles for longevity in the lower body. But the advantages extend beyond circulation. Calf activation is essential for fall prevention, stability, and re-engaging the complete muscular chain of the legs. Every step, every stair, and every effort to maintain balance hinges on ankle strength and the calf muscle's ability to respond quickly to changes in terrain. With aging comes a perilous trend, reduced strength and elasticity in the Achilles tendon, coupled with a decrease in type 2 muscle fibers, which are responsible for power. This results in shortened steps, dragging feet, and frequent stumbles. A strong calf, on the other hand, stabilizes the ankle, improves proprioceptive signals to the brain, and revives balance reflexes, providing a critical line of defense against falls, the leading cause of fractures and loss of independence in older adults. Furthermore, activating the calf ignites the entire posterior chain, including the hamstrings, glutes, and spinal erectors, enhancing posture, gait, and the ability to walk greater distances without discomfort. It's a simple, low-impact exercise, but the results are monumental. Increased ankle strength, improved circulation, enhanced stability, reduced swelling, fewer cramps, and a more youthful, fluid, and safe gait. That's why it's referred to as the pump of life, because maintaining its strength literally keeps mobility alive. Exercise number 3, marching in place. Marching in place with high knees is one of the most comprehensive, safe, and effective exercises for older adults aiming to enhance cardiovascular health without impact, regain agility, and train balance simultaneously. In contrast to walking outdoors, where risks of stumbling, uneven surfaces, and distractions can create anxiety, this exercise takes place in a controlled environment. This setting enables older adults to elevate their knees, engage their hips, and move their arms with more freedom, rediscovering motor patterns that often fade with age. Each knee lift strengthens the psoas, hip flexors, and core stabilizing muscles that are vital for taking confident steps and elevating feet off the ground, a common issue in older adults' gait. Simultaneously, maintaining a steady, rhythmic pace gently elevates the heart rate, improving lung capacity, circulation, and endurance without imposing stress on the knees, ankles, or hips, making it an ideal choice for people dealing with overweight, osteoarthritis, osteoporosis, or movement restrictions. Additionally, coordinating arm and leg movements stimulates neuroplasticity, reinforcing the connections between body and brain, which translates into swifter movements, enhanced reaction times, and a more stable, secure gait. This intentional cardio exercise also carries emotional benefits. It alleviates stress, boosts mood, and fosters a sense of bodily control, especially crucial for those who may have lost confidence in their mobility or are fearful of falling. However, its true power lies in its ability to transform gait mechanics and balance stability simultaneously. Deliberately raising the knees prompts the reactivation of deep muscles in the abdomen, glutes, and pelvic area, restoring stability where all human movement originates, the body's center. An active core leads to better hip alignment, straightened posture, and strain reduction on the spine, lessening lower back discomfort and refining natural walking technique. Furthermore, marching with high knees enhances dynamic balance as the body continually transitions weight from one foot to the other, practicing weight control, ankle stability, and proprioception, the awareness of where the body resides in space. This is essential as aging typically slows reflexes, shortens stride, and widens the base of support in an unconscious attempt to feel safer. Yet this rigid pattern actually heightens fall risks. By retraining the natural gait cycle, this exercise restores fluidity, rhythm, and confidence. Noticeable progress can be seen within just a few weeks. The older adult will walk with a firmer, longer, more agile stride and their head held high. In just 2 to 5 minutes a day of marching in place with high knees, not only is the heart improved, but youth is restored to movement. Exercise number 4. Squat. The squat is, without a doubt, the most crucial functional movement for maintaining independence and strength at any age, particularly after 60. It's the action we perform every time we rise from a chair, the toilet, or the bed. Losing the ability to execute this simple motion unassisted signals the onset of physical dependence. However, as years go by, muscular weakness, reduced hip and knee mobility, and fears of pain or falling often lead to many individuals abandoning this instinctual movement. What many don't realize is that evading squats accelerates deterioration. When not regularly practiced, the muscles in the lower body, especially the glutes, quadriceps, and core, lose their tone. Joints become stiffer and balance weakens. The squat, by engaging large muscle groups concurrently, serves as the best natural remedy against sarcopenia, stimulating both fast and slow muscle fibers, improving bone density, activating hormonal responses, and enhancing metabolism. Unlike other exercises, the squat is entirely functional. Each repetition teaches the body to move with precision, align the spine, maintain core stability, and transfer strength from the legs to the rest of the body. When performed correctly, the squat becomes a comprehensive training method that re-educates movement patterns, protects the knees, strengthens the hips, and restores confidence when standing up. But beyond strength, the squat offers something far more valuable: autonomy. It strengthens the connection between body and mind, enhancing coordination, proprioception, and dynamic balance. Three fundamental pillars in preventing falls, which are the primary cause of fractures and loss of independence among older adults. Research in aging physiology has shown that incorporating squat exercises, even with simple body weight or by using a chair for support, can significantly improve bone mineral density, walking speed, and the ability to respond effectively when faced with stumbles. Additionally, through breath control and deep abdominal activation, squats strengthen the core, stabilize the pelvis, and alleviate lumbar pressure, resulting in a more upright posture and safer walking. Initiating practice with a chair or wall support is entirely safe, and regular execution fosters more efficient blood flow in the legs and hips, helping to ward off morning stiffness and joint discomfort. The emphasis isn't on the number of repetitions, but rather on the quality of movement, executed with awareness, stable feet, controlled breathing, and engaged abdominals. With just 5 to 10 minutes a day, the squat becomes a powerful tool for maintaining strength, mobility, and dignity. Because it transcends mere muscle training, it promotes the freedom to move without fear, to rise independently, and to continue enjoying life with vitality and security. Exercise number 5, glute bridge. The glute bridge is one of the most effective, safe, and transformative exercises for older adults. It strengthens the posterior chain, including the glutes, hamstrings, spinal erectors, and deep core muscles, acting as the true protective shield for the lumbar spine. With age, a sedentary lifestyle, prolonged sitting, and the progressive weakness associated with sarcopenia create a troublesome cycle. The glutes become inactive, the pelvis destabilizes, the lumbar region begins to compensate, and pain emerges as a consequence. This pattern is so prevalent that it has been labeled dead butt syndrome, a condition whereby the glutes no longer fulfill their primary functions, stabilizing the hips, absorbing impact, and safeguarding the spine during activities like walking, standing, or climbing stairs. The glute bridge effectively reverses this process by re-engaging the gluteus maximus, the largest and strongest muscle in the body, while also awakening the deep muscles responsible for pelvic support. By lifting the hips against gravity, muscle fibers that are seldom activated in daily life are stimulated, enhancing tone, circulation, and endurance. But the benefits extend beyond the localized area. Strengthening the posterior chain helps the body regain its natural alignment, alleviating pressure on the lumbar discs, improving posture, and minimizing the hyperlordosis and stiffness that many older adults experience upon waking or standing for extended periods. Moreover, this exercise activates the core without requiring abrupt movements, making it one of the most effective and safest options for individuals concerned about injury, those who rely on a back brace, or those suffering from recurrent lower back pain or weakness. The impact of the glute bridge on daily life is remarkable. It strengthens the muscles that significantly influence functional independence, walking stability, and fall prevention. When the glutes and deep core function optimally, the hips stop moving erratically, steps become firmer, and the body regains the ability to generate strength from the center, a necessity for all human movement. Additionally, enhancing the posterior chain's functionality increases proprioception, which is the brain's ability to assess body position, thereby speeding up reaction times when unexpected stumbles occur and safeguarding older adults from the primary cause of fractures, falls. From both metabolic and circulatory perspectives, the bridge facilitates venous return, alleviates lower back tension, and reduces inflammation stemming from years of poor posture or muscular weakness. Even breathing improves. By strengthening the deep core and opening the anterior chain, the diaphragm can work more freely, enhancing oxygenation and reducing fatigue during walking. With just 5 to 10 minutes a day, the glute bridge not only alleviates lumbar pain, but also restores natural movement patterns to the body, reinstating firmness to the hips, stability to the gait, protection to the spine, and a renewed youthful energy when getting up, sitting down, walking, and simply living. That's why this exercise is considered a cornerstone in longevity and modern rehabilitation programs. It not only strengthens but also restores independence. Exercise number 6, lateral leg raise. Lateral leg raises are among the most strategic exercises for older adults, targeting a muscle group that is often neglected yet vital for body stability, the hip abductors, particularly the gluteus medius. This muscle is essential for maintaining balance while walking, stabilizing the pelvis, and preventing the knee from collapsing inward. As the years progress, especially after 60, this muscle is prone to atrophy due to a sedentary lifestyle and the natural loss of muscle mass associated with sarcopenia. When the gluteus medius weakens, a cascade of issues follows: unstable gait, pelvic swaying, lateral hip pain, a common complaint among older adults, increased strain on the knees and ankles, and an elevated likelihood of falls. Biomechanical studies have shown that the gluteus medius acts like the body's airbag, providing stability to the leg with each step. This muscle engages in mere milliseconds to maintain our center of gravity. However, if it becomes weakened, the brain loses this automatic response, leading to a significant decline in balance. Lateral leg raises reactivate this forgotten function by isolating the movement, awakening the mind-muscle connection, and strengthening the deep stabilizing fibers that go unactivated during walking. Neuromuscularly, this exercise enhances proprioception, the body's ability to perceive its location in space, and trains lateral control, often overlooked in balance and human movement. While walking typically involves forward and backward motion, the majority of falls in older adults occur laterally. Thus, bolstering lateral stability is crucial for aging with mobility and confidence. The daily impact of lateral leg raises is substantial. They strengthen the hips, restore gait firmness, improve posture, and re-educate the body to move with control, eliminating the insecure swaying and clumsy steps. Additionally, they help rectify structural issues linked with aging, such as ankle weakness, knee valgus, lumbar overload, and loss of pelvic alignment. At the joint level, this exercise enhances hip lubrication and reduces stiffness that often arises from years of inactivity or mild osteoarthritis. Controlled movements elevate synovial fluid production, nourish cartilage, and mitigate discomfort. Furthermore, by reinforcing the gluteus medius, the pelvis stops dropping with each step, resulting in a more stable and efficient stride. This translates into greater confidence when navigating streets, ascending stairs, or standing unassisted. What's essential is that this exercise is low impact, safe, progressive, and appropriate for a variety of conditions, making it a therapeutic tool widely employed in physical therapy, hip rehabilitation, and contemporary fall prevention programs. With just 2 to 3 sets of 10 to 15 repetitions per side, 3 times a week, older adults can experience noticeable changes within a few weeks. Firmer steps, improved balance, reduced pain, and a renewed sense of control over their bodies. Thus, lateral raises are not merely a means to strengthen the legs, they serve as an antidote against fragility, insecurity in movement, and the fear of falling, the very fear that often strips freedom away after 60. In addition to the individual benefits of each exercise, the true power arises when they are sequenced into a progressive routine. The combination of squats, glute bridges, lateral raises, and other movements activates what science refers to as fundamental movement patterns, those essential gestures that enable human autonomy. Pushing, pulling, stabilizing, hip extension, weight bearing, and balance maintenance become second nature. Various studies affirm that after 50, the greatest threat to quality of life isn't age itself, but the cumulative loss of muscle mass from sarcopenia and declines in neuromuscular strength, which negatively impact balance, posture, endurance, and joint function. These exercises tackle the issue at its core. They engage the glutes and core, the engines of vitality. Strengthen the stabilizing muscles of the hips, alleviate spinal pressure, re-educate gait patterns, enhance proprioception, and recalibrate the body to move with improved efficiency, elasticity, and control. In essence, they do more than just build muscle. They restore the essence of human movement, reviving agility, gait security, and the ability to climb stairs, squat, get up from the floor, or carry weight without fear or discomfort. This form of training, when practiced consistently, brings forth effects that extend beyond the physical realm. It enhances brain oxygenation, decreases systemic inflammation, stabilizes glucose levels, reduces fall risks by up to 50%, and activates metabolic pathways related to longevity, such as AMPK and mTOR within their optimal ranges. What's particularly fascinating is that the body responds positively at any age, even beyond 70 or 80, because muscle is a tissue that adapts throughout life. Thus, every repetition counts. You are teaching your nervous system to move more effectively, fortifying your skeleton through muscle, and securing your independence for the future. Approach this journey with intention, patience, and consistency. Your body isn't designed to age in fragility. It simply requires the right stimulus to awaken its true potential. Aging need not equate to losing strength, balance, or freedom. You've seen simple, effective, and scientifically supported exercises capable of transforming your body and your life if integrated with consistency. This is your moment to decide. Continue letting time dictate your fate, or seize control and forge a strong, stable body unencumbered by the fear of movement. Don't wait for pain, dependence on others, or a restricted life to motivate you. Start today. Like this video, subscribe to our channel, activate the notification bell, and save this content. Practice the routine and join me on this journey toward active, independent aging, full of energy. Your best self hasn't vanished into the past. It stands before you, ready to begin with the first repetition. Your body and health will be grateful.